Ladies and gentlemen, it's a real pleasure to introduce to you Julia Schopick. She's an author and also a journalist, and came to this field because, like many of us, a loved one, in this case her husband, came down with cancer. So she started researching. She has a blog, she's written books, and we're very happy to have you here.
Thank you, Frank. So I set out to find treatments that nobody could question their effectiveness. That even though doctors might question their effectiveness, that there's no question that they work. So, by the way, I have to tell you that this wasn't right after. After Tim came home from the hospital, he lived for 3.5 more years, bedbound, incontinent, and still my husband. So I spent the next 3.5 years taking care of him. And then afterwards, it just kept gnawing at me. I've got to find other treatments to write about that can educate people and can give solutions to people that don't have them. So I wanted to write about the treatments. I wanted to first I wrote an article, then I wrote a book, Honest Medicine. And I wanted to just be able to tell people about them. So let me tell you about some of the treatments I found. You can see I'm not used to doing PowerPoints. The 3 treatments are Lowdose Naltrexone, and I'm going to tell you about that. It's a fabulous treatment. The Ketogenic Diet for pediatric epilepsy, and Intravenous Alpha Lipoic Acid for liver disease, for some cancers. It's pancreatic. It's had extremely good results with. So these were treatments that, as I said, nobody could argue with, that they would just be, it would be obvious that they worked, and I hoped that by writing about them, I could help a lot of people. The first one is Lowdose Naltrexone. Have any of you ever heard of it? No. Okay. But you have, and a lot of people have, I know. Lowdose Naltrexone, all of these are fascinating stories, and I wish I had more time, but I just love the fact that I can tell you a little bit. Lowdose Naltrexone was actually FDA approved at a high dose. It's called naltrexone at 50 milligrams in 1984 for the treatment of drug addiction and alcohol addiction. In about the same time, a doctor, a very creative doctor named Dr. Bernard Bahari, was working with drug addicts. So that's how he learned about naltrexone, the high dose one. And a lot of these drug addicts also had HIV/AIDS. And Dr. Bahari, very curious, not like the doctors that I was confronted with when Tim was sick, but he started to say, I wonder what would happen if I gave it at a low dose to some of these people. So he started out by treating people with AIDS, HIV/AIDS, with very low doses of naltrexone. He figured out that somehow it raised endorphin levels, and they started to get better. And then the friend of his daughter came down with multiple sclerosis. And at that time, thank God, there were no multiple sclerosis drugs. I say thank God because she would have been on them if there had been. So Dr. Bahari gave her some of this low-dose naltrexone. By the way, 1/10 of the dose that had been FDA approved. I want to stress that, because when doctors today say, oh, we don't know if it's safe, well, if it was deemed safe at 50 milligrams, so at 4.5, it can't really be unsafe. So he gave it to her, and she did well. Somehow, people started hearing about this Dr. Bahari, and they started hearing about this low-dose naltrexone, and they flocked to New York to get prescriptions for it. And it became a cause célèbre, especially with MS patients, multiple sclerosis patients. Don't ask why, but they're very, very active in helping others. But it also was working for lupus, for Crohn's disease, rheumatoid arthritis, HIV/AIDS, as I said, and cancers. Also working for cancers. I take it preventatively for cancer, and so do a lot of people. So this was, you know, people were seeing great results. Now, 3 chapters of my book are told by patients or a patient's wife. They're the stories of how they found low-dose naltrexone and how it really turned their MS around. It stopped the progression. In some cases, it really turned the disease around, so to speak. And one of the people who wrote, Dr. Bahari, was very ill when I was writing my book. I became very friendly with his widow, with his wife. But one of the chapters was written by Dr. David Gluck, who was a childhood friend of Dr. Bahari's. Every single one of these people talks about how it has helped the diseases that they, you know, that they take it for or that their loved ones take it for, and every one of them has told about how the doctors don't believe it. The wonderful thing about LDN, as we call it, low-dose naltrexone, is these patients have taken it up. I love these patients. There are thousands, put in low-dose naltrexone. You see the spelling of it? In Google, and you will see, put it in quotes, you'll see 2 million hits at least. This has taken off, and people are taking it. I'm proud to say that I help people find doctors who will prescribe it, and we're getting it known all around. I should say the patients are. I do my little bit to do it. And they have spread the word. And this, by the way, is how I think medicine will change. I do not think it will change through doctors wanting to change it. I'm sorry to say. Not the doctors who speak here, but you know what I'm talking about. Anyway, the next treatment is the ketogenic diet. Do any of you know about it? Yeah. It is a very high-fat, low-protein, low-carbohydrate diet, and its original use, the one I'm going to talk about, and the one I talk about in Honest Medicine, was for pediatric epilepsy. And now it's actually being studied for brain tumors and other diseases too. But as I said, it's a high-fat, low-carb, low-protein diet. And the interesting thing about this one is that until anti-seizure medications were started to be invented in the 30s, this was the standard of care at Johns Hopkins, at Mayo Clinic, and this was all that was known for pediatric epilepsy. But then came Big Pharma, and then came the medications, and it fell out of favor. By the way, there were studies done, small studies, all the way from the 20s, the 30s, the 40s, all the way to the present, showing that the ketogenic diet is effective in, I think the figure was 67% of cases of children with pediatric epilepsy. Now, for some reason, doctors didn't want to prescribe, they didn't want to recommend it after the drugs came. So it would have died, the diet would have died, in my opinion, if not for a wonderful man named Jim Abrams. He's the only hero of this book, you know, champion of the treatments that I write about in my book, that is not a doctor. He is amazing. He was the Hollywood producer of the funny movie Airplane, the one with Leslie Nielsen, and also of Hot Shots. And but then something not so funny happened. In 1993, his infant son, Charlie, started having what they call intractable seizures, seizures that would not quit. Some days he would have hundreds of them. And of course, Jim, with his prestige and all that, he could go to the best of the best of the best hospitals. And the best of the best of the best hospitals kept drugging this poor child. There is a Dateline NBC video that's on YouTube that shows little Charlie literally bumping into walls. He had to have a harness on his back so that he was so drugged. He was so drugged up. And yet, whenever Jim would say, oh, I don't, anyway, they would give him combinations of the drugs too. They even did a surgery on his brain. Nothing worked. So Jim actually went to the library. This was before internet days. And he was actually in the process of researching what is our family going to do with this child who the doctors say will never get better. And he found that there had been a diet since the 1920s that was, so he took this information excitedly to the doctors. By the way, he wrote a chapter in my book too, and the beginning of the chapter is quotes from all these studies. You know, the ketogenic diet, da-da-da-da-da. Just, you know, loads of quotes. And what do you think the doctor said? It won't work. And he's like, well, you know, it's been written up to, it won't work, trust us. So he allowed Charlie to have a brain tumor, excuse me, that was my husband, a brain surgery to try to stop the seizures. That didn't work, and Jim said, enough. And he took Charlie to Johns Hopkins. He was put on the diet. 48 hours later, seizures stopped. Not only did seizures stop, I know, you could clap when you hear that, right? They stopped, and they did, you know, he's fine now. But, of course, the drugs that he was on and the surgery have left him with some deficits, but he has not had seizures, and he doesn't have to stay on the diet anymore. Now, Jim first was excited. Oh, this is fantastic. Then he got pissed. He said, why did it take me so long to find this diet? Why are other parents being discouraged to do it? And then he said, aha, light bulb moment. In my position, his position of being a Hollywood producer and very well connected, he said, I can do something. And he did. The first thing he did was he got his friend Meryl Streep to do an instructional video about the ketogenic diet. If you go on charliefoundation.org, CHARLIE foundation.org, you will see Meryl Streep, you'll see this video of Meryl Streep. And so through that, then what happened was that somebody on the set of that was working with Dateline NBC and said, this is a cool story. So Jim and Charlie's story was on Dateline NBC. And then in one of the Dateline things, he shows the boxes and boxes and boxes of letters he got from parents. Where do I get this diet? And then he did one more thing. Meryl Streep came through again. Meryl Streep played the mom of a kid with epilepsy in a movie, which you can get actually on YouTube, called First Do No Harm. And it was a made-for-TV movie of a mom who was kept from getting the diet and really, really, really she did get the diet, and it did work. So Jim, through the Charlie Foundation, now he has hired a dietitian. The dietitian goes around the world, not just around the country, educating doctors and other staff at hospitals. And thanks to Jim, this diet is now being administered in, I believe it's 150 hospitals around the world. Yeah, isn't that? I love that man. It's sort of like, he once told me that now he can sleep at night. He told me this recently. We've become good friends, as I have with most of the people that are in the book. He told me he can sleep at night knowing that the Charlie Foundation website is up there and people can now find the diet. The third treatment that I write about is called Intravenous Alpha Lipoic Acid. How many of you know about this one? Frank, you know about all of them, right? This one is interesting. They all have their little interesting features. This one's feature is that one man, Dr. Bert Berkson, and one man alone, found out that that intravenous alpha lipoic acid, an intravenous antioxidant, worked for liver disease, terminal liver disease, as a matter of fact, and also with low-dose naltrexone that I told you about before, for some very serious cancers, including pancreatic. And his story is, it goes through the whole thing of doctors not believing it, but I'll tell you about it anyway. In the 70s, I believe, he was an intern in a hospital, and patients came in and they were dying of mushroom poisoning. It was ruining their livers. And he was told, Dr. Berkson was told, to just watch these people die and take notes, because he would be presenting the notes as to how the deaths occurred in grand rounds. in the next few days. And he says, you know, I just can't do this. He didn't say this to his superiors, but so he started finding out, is there something else that might work? And he said, I've read something recently about something at the National Institutes of Health. I forget, he didn't know what it was, but he called up and he said, is there anything, I read about something that regenerates organs? And they said, yeah. And it was intravenous alpha lipoic acid. He got the intravenous alpha lipoic acid. It was sent by plane. He infused it into these people. They are alive today. And what do you think happened with the hospital? Were they happy? They were furious. He had done something he was told not to do, which was not to do anything but watch them die. So he now is working in Las Cruces, New Mexico, a solo practitioner. He did leave institutional medicine, thank goodness. And now he is helping people with liver disease, autoimmune diseases, cancers, and he's a happy man. So I would like to leave you with a quote from Margaret Mead. And this is how I feel about the medical system. She says, never doubt that a small group of committed citizens can change the world. It's the only thing that ever has.